Okay, so today we will be discussing the topic of ABCDE and the AVPU approach, which is AVPU is part of ABCDE, and we will be discussing what that means and where we can use this. So this lecture is going to be more of a practical focused lecture. We will try to not go into too much theoretical details, but the point of this lecture is to make sure that we know the base, we know the foundation of what we can do if our emergency assessment is required from us. So let's go. What we'll do is we'll start one by one. We'll start by talking about A, then B, C, D, and finally E. What we're going to do is for each letter, we have to check two things. Number one, we'll talk about what is it that we can check in that patient. And number two is what we can do or solve. So starting with A stands for airway. So in airway, we're not just checking airway, we're actually checking another thing also. We're checking the spine. The reason we're checking the spine is in cases of trauma, we want to stabilize the spine. And in airway, we're making sure that the patient does not have any problems breathing. So a good way to assess this is if you start talking to the patient, if the patient talks back to you, you can see that clearly the airway is patent at that point of time. So here in airway, in A, when we see the patient, the first thing we're supposed to check is whether the airway is patent. And the second thing we have to check if the spine is stable. If in doubt, how do you solve these problems? If you think that there is an obstruction in the airway, the way to solve that problem is simple. We remove the obstruction. And if we think that the spine is not stable, we stabilize it. And we can stabilize using various methods. One of them is called triple immobilization. There are others you can use a neck collar as well. The next thing is B. B stands for breathing. So the point of B is to make sure that the patient's oxygenation is good. So the two things that you have to do here in breathing is we have to check the patient's oxygenation, which is starting off using the examination. The examination involves the respiratory examination. So this means what we need is the patient's respiratory rate. We need to auscultate the patient's chest, and we need to percuss it. Make sure that his lungs are functioning okay. Second thing we have to check is the patient's oxygen saturation. This is important, and the way we can do that is we put an oxygenation probe which will tell us whether the patient is oxygenated enough. So these are the two things that we have to do in breathing. Respiratory exam, check the patient's respiratory rate, auscultate, percuss, and put on a probe, an oxygen monitor, and see if the patient is oxygenating. This will give you an idea of whether he's able to take in oxygen and then use it. If the problem is there, what can we do? So, if there is no respiratory effort, it is important to call the arrest team. And if you feel the patient is not oxygenating, we can start him on high flow oxygen, high flow O2. This can be, for example, 15 liters via non-rebreathing mask. So moving on to the next one. C. C stands for circulation. What can we check? So in circulation, what we're trying to determine is whether the patient's cardiac output and the entire cardiovascular system is functioning properly. And this includes the pulse, BP, any signs of bleeds. So how can we start off? The things that we check is number one, pulse. Also, we also need to include blood pressure in it, whether the patient is in shock or is normotensive. Another thing we have to make sure is we have to check for peripheral signs of shock, which means, for example, the patient can have cold peripheries, and in this situation where I have drawn is the capillary refill time. If it's delayed, if it's too long, then that would mean patient's peripheries are not receiving enough blood, which could be a sign of poor cardiac output. So, and another thing that you have to look for is external signs of bleeding, which will indicate to you whether you need to deal with that urgently or not. So now that you have checked these things in the circulation, you've checked the patient's pulse, you've checked the blood pressure, checked capillary refill and other signs of peripheral shock, and you've noticed if there is any site of external bleeding. How can you solve this? Well, to solve this, number one, to bring the blood pressure up, you can give the patient fluids, IV fluids. Again, if there is no cardiac output, call the arrest team. And lastly, you can attach the patient on a heart monitor, which will monitor the patient's electrical activity of the heart. Next, we'll move on to disability, where we will assess the patient's level of consciousness. So number one thing you can start off with is take a torch and shine a light in the eyes to check if the pupils are responsive. Next, you can measure the level of consciousness using AVPU, and now we will talk about what AVPU is. So next, we will determine whether the patient is alert, verbal, pain, unresponsive in the AVPU score. So A stands for alert. That means you don't have to talk to the patient for him to be, for them to be responsive to you. The patient will be alert and will be talking on their own, responding on their own. You won't have to give them cues like verbal cues. In that situation, the patient will be alert on the AVPU. On the other hand, if the patient is only responding to verbal commands, then we will consider it as verbal. But if the patient is also not responding to any verbal cues, but you have to elicit pain in the patient for them to respond to you, then we would consider it as B in the AVPU. Otherwise, on the AVPU score, if the patient is not responding to even pain, then we would grade them as U on the AVPU. And lastly, you have the Coma scale, but only if you have the time. Otherwise, you can delay it and you can do it later on as needed once the patient is stabilized. So as for the solve component of D, there's not much to solve when it comes to these AVPU, GCS, or even the pupils. The main idea is to solve the underlying cause. Lastly, we come to exposure. So in exposure, what you're checking is whether the patient is adequately exposed. That means you can see enough of the patient's body to determine whether there is any external signs of hemorrhage, any external signs of trauma, or any rash, or whatever it is that you're looking for. So make sure that is adequate. And if it's not adequate, how can you solve? Well, you can expose the patient enough to make it more obvious for you, but also make sure that you don't expose them so much that it causes hypothermia. So that has to be kept in mind. So finally, after ABCDE, the next step would be to manage the cause. So this is where you determine, or you try to find out, what is it that caused the patient to go into this condition of instability. So here you would go through your original plan of history taking, doing investigations, and then following it up with the management, whatever it is for the patient, depending on the cause. So that's about it for this discussion. I hope you found something useful in this lecture, and I hope that when you are called to see an unstable patient, you are able to remember these points and stabilize the patient before moving on to the next steps. If you would like to go deeper into this discussion, I have also linked in the description my resources for you to be able to go through if you'd like to go further into this discussion. Thank you for watching.